Today we're talking about sudden blurry vision, and if that interests you, stick around. Hey guys, welcome to the EyeCare and Wellness channel. I am Joel Hayden. If we haven't met before, welcome. And we talk about all things optometry, wellness, how to take care of your eyes and yourself for life. Let's get at it. So today we're talking about sudden blurry vision, and it's a real serious topic because many of these causes are not only sight threatening, they could potentially be life threatening. And while there are probably hundreds of causes of sudden blurry vision that I could think of, I'm only going over a few because they're the most common ones that I've seen in my practice. So I'm going to start this with the most crucial information first that I think is really important for you to know. These are the things with sudden blurry vision that could be the worst case scenarios. So number one is a stroke. So if you have sudden blurry vision in one eye or both, and you have either drooping of the face, a tingling or numbness of the arm, or it could be any of these three, trouble speaking, I would worry that you're having a stroke. Dial 911. There is no messing around with that whatsoever. The second thing that really concerns me that you could have, if you have sudden blurry vision in one eye and a lot of pain, and I'm talking so much pain that you want to throw up, it's nauseous. I'm worried you may have something called a closed angle glaucoma attack. And if that's the case, it's usually people who are farsighted, and it can happen out of the blue. The pupil size may be a little bit different, might be a little bit larger in the eye that is very painful. You need to get somewhere quick. If you can't get to an eye doctor, go to the ER, because that can be sight threatening. The pressure can be spiking, and the sooner you get there, the sooner they're going to be able to take care of it and bring that pressure down and restore your vision as best they can. The next one is a retinal detachment. And if you have a retinal detachment, you can have sudden blurry vision in one eye. Sometimes it'll look like a shade coming down. Sometimes you'll see a lot of flashing lights and a lot of floaters. That needs to be looked at immediately. Again, preferably an eye doctor. And you can have floaters without flashes. You can have floaters without a lot of loss of vision. But no matter what it is, flashes, floaters, I would go see your eye doctor immediately, at least call and get some direction from them. The next thing is an ophthalmic migraine, which is an aura that you can get before you get a migraine. Some people never get the migraine. It can happen in one eye or the other or both. And it usually lasts about 20 minutes, and it can be really disturbing because it is weird. It breaks up your vision. Everyone's different in how it progresses and presents. But if that happens, if you get sudden, really unusual visual disturbances, you might want to hang out for 20 minutes. You might want to take some Advil or Tylenol or whatever you usually take for a headache, because you could be getting a migraine after it. The problem is that type of sudden blurry vision and the type that you get when you have a stroke can look very similar. Like I said, if you have the numbness in the arm, the facial paralysis, or trouble speaking, that's a no-brainer. Call 911. That is not an aura from a migraine. But if you have nothing else and you think it may be an aura from a migraine, hang out for 20 minutes. It usually goes after 20 to 30 minutes. I would still suggest seeing your eye doctor anyways. Give them a call, because a migraine aura can also look like a transient ischemic attack, which is my next one, which is almost like a short stroke. It's a loss of oxygen to the brain for a short period of time, and then it clears. But that needs to be looked at, because you could have your carotid arteries clogging up on you, and a little piece of plaque passed through, got stuck, popped through, and then all of a sudden everything seemed fine. But you want that looked at. You want to make sure it's okay. Call your doctor if that happens. That typically doesn't last the 20 minutes like the aura. But these are all tough things, and that's why I think if you have any of these and you're not sure, go to the eye doctor. He will let you know. He or she will let you know. So next, let's bunch together everything else that could cause sudden blurry vision with pain. And that could be an abrasion. You get hit in the eye with something. I mean, that's going to be a no-brainer. You're going to know what did it. That's going to be go to the eye doctor, as is almost everything else with pain. So if you're experiencing a lot of pain with sudden blurry vision, get to your eye doctor. Call them right away. It could be inflammation of the front of the eye, which we would call an anterior uveitis. It could be inflammation of the cornea, keratitis. It could be inflammation in the back of the eye, posterior uveitis. And it could be an optic neuritis. So any of those could cause pain and blurry vision. I would get there as soon as you can. Undiagnosed diabetics, people who have high blood sugar, can experience a big shift in vision. It's usually pretty quick, within a day or so. Let's take a 50-year-old guy who sees great far away. He uses reading glasses up close. All of a sudden, he can read, but he can't see far away. So the optometrist is the first line typically for a lot of these things, and diabetics is no different. We tend to pick it up sooner because people come in complaining of blurry vision. But if you're having blurry vision quickly like that, and you're diabetic, certainly call your primary, because your numbers may be off. But if you think that maybe diabetes could be a thing, which makes a lot of sense if you are getting up in the middle of the night to pee a lot where you never did before, or if you're drinking a ton of water and you just can't seem to drink enough water, which of course is the reason why you're peeing so much, you may be an undiagnosed diabetic, especially if you're finding you're having the sudden blurry vision along with it. So I would get right to your primary care. Call them. Can't get to them, go to a walk-in clinic. You need to get your blood sugar checked, because if it's not where it should be, normal blood sugar runs between 80 and 120, and diabetics are above 120. But we're not talking 150 or 180. I had a gentleman about a year ago that came in, similar complaints, asked him about getting up in the middle of the night to pee, and he's like, yeah. I sent him right to his primary that day, because it can be really high. And his was 670. So that's really scary. He could have had some major health issues with his blood sugar that high. So don't mess around. If you have those symptoms and sudden blurry vision, call your primary ASAP. And like I said, if it's a Sunday and you can't get a hold of them, go to a walk-in clinic and let them know your symptoms, and they'll take care of you. And then the simple things like pink eye that can cause sudden blurry vision. Usually it's really goopy, it's a lot of mucus, and if that mucus gets in front of your pupil, it's going to cause sudden blurry vision. But this is not going to be a big revelation to you, because you've got a red eye, it's goopy. Call your eye doctor, because that needs to be taken care of. And then there are a few things that you wouldn't expect to cause sudden blurry vision. Things like macular degeneration or regular glaucoma, which tend to be slower chronic diseases, or a cataract. On Monday morning of this week, a patient came in and was complaining of sudden blurry vision in one eye. I thought that was amazing, because I'm scripting this video during the week. And this is an unusual case, but it goes to show that you may be experiencing sudden blurry vision where it wasn't really that sudden. He comes in, he says left eye, all of a sudden he notices it's really blurry. So I check his eyes. His right eye, he is correct, sees absolutely fine. And his right eye, his left eye, I can't get to 20/50, 20/60. So I take a look, and lo and behold, he has a cataract in his left eye. Now that cataract didn't just occur out of the blue. Like, boom, they can. Usually trauma can do it. Even old trauma can make them go quickly. But this was a typical normal looking cataract. So why did he think it appeared all of a sudden? Why did he think it was so quick? Here's my theory. I didn't even go over it with him as far as me telling him he was wrong, that it didn't appear suddenly. I just don't think it did. I think he had that cataract developing in his left eye, and one day he itched above his brow in his good eye and blocked off the vision from the good eye, and now he's looking with only the bad eye. Oh my gosh, my left eye, I can't see out of it. And that's usually what happens. I've seen that happen at least 50 times in my career. So if you're experiencing sudden blurry vision, I hope you're not still watching this video. I'm hoping you did what I told you to do. If nothing else, call your eye doctor. Let them know what you're noticing. They will either bring you in or tell you to do what's right. So I hope this was helpful. If there's any questions you may have, put them in the comments down below. And until next time, take care.